Malawi, the warm heart of Africa. It lives. It breathes. And it struggles. The following footage depicts only some of the struggles that this population faces every day.
Poverty.
Couldn't find food.
Low access to education.
I wasn't going to school.
Domestic violence.
He's going to kill me or he's going to throw me out of the house.
Broken families.
I have 4 brothers and 6 sisters.
Drug and substance abuse.
As you know, I've been sick for a long time.
Stressed children.
That's when I saw him taking off his clothes and he raped me.
The first step is knowing. Knowing that we are all connected. Knowing that at some point we have all benefited from an innovative mind and a helpful hand. The next step is creating a plan. A plan that will be effective, sustainable, humanistic, culturally adaptable, and feasible. The National Board for Certified Counselors and Affiliates has created a program to meet this criteria. The Mental Health Facilitator.
NBCC decided to create the Mental Health Facilitator program really based starting on a challenge from a gentleman by the name of Dr. Benedetto Saraceno. He's a psychiatrist from Italy, and at the time he was the director of the Department of Mental Health and Substance Abuse for the World Health Organization. And some of the leaders from NBCC, our president and CEO at the time, as well as board members, were present at a conference when Dr. Saraceno basically challenged counselors to do something about the 450 million plus people that he believed in the world are either not served at all or underserved in the area of mental health services. NBCC took that challenge very seriously, and over time, in conversations with Dr. Saraceno and other people at World Health, developed the Mental Health Facilitator program. The center that we refer to in Lilongwe, Malawi is called the Guidance Counseling Youth Development Center for Africa. We've had an ongoing relationship with the center really since it was founded. UNESCO helped fund the center to get it started, and they knew that we were very interested in working in Africa, and they knew about the expansion and the work of NBCC International. So they told NBCC, the leadership of NBCC, about the center when it was being built and about the purpose of the center. Kenneth Mwaka is the director of the center. He was introduced to NBCC through UNESCO, and we started a relationship with him. And when we were ready to start piloting the program, he volunteered that the center be one of the first places we hold trainings.
You have managed to attract other friends to know their status, and so many people are doing so because you have been empowered on how to communicate mental health facilitation.
Especially our program partners that we've worked with to develop MHF program in certain countries have been material. Their feedback to us about the program, what works, what doesn't work, about the curriculum, what needs to be changed, what needs to be added, how does it need to be contextualized, is a big reason why the program we think has been successful. It also really is about the backing of the NBCC Board of Directors, who have been behind this endeavor from the very beginning and continue to support the endeavor as we expand in NBCC International and we expand in our services in the MHF program. And of course, the beginning of the development of the MHF program and the ongoing development of the program would not be possible without the ongoing support of the NBCC Foundation. From the beginning, when the foundation supported the very first training of trainers we've had in Malawi, that board has consistently provided support for a number of countries in the development of the MHF program. And of course, Dr. Tom Clausen, who is our president and CEO, and of course helped with the concept from the very beginning. Dr. Scott Hinkle and Dr. Donna Henderson. Dr. Scott Hinkle is an employee of the National Board for Certified Counselors and works closely with NBCC International, has co-written the curriculum from the very beginning, and we're now in its 21st version with Dr. Donna Henderson, who has volunteered her time. She's a professor of counseling at Wake Forest University. Scott and Donna have worked very hard on the curriculum over time to make sure that it remains responsive to what our program partners are telling us they need the MHF program for. Adriana Petrini is our programs coordinator. She handles all the day-to-day work for the MHF program. And then it filters down to our master trainers and our trainers, many of whom have been trained in the curriculum and really donate their time. They don't get paid for assisting us in opening a program or developing a program within a certain place or country. A lot of people have worked very hard to develop this program to keep it ongoing, and we couldn't do it without everyone's help. We have mental health professionals who are trained in the program, who then travel to or already in the country, the partnering country, and they train a local group of trainers in the curriculum. They not only train them in the full curriculum, but they also break the curriculum down and teach them how to train it.
You convey the message and get it to the people in such a way where it becomes meaningful. You know, we look at that this is going to be a healing agent for people. And you just don't know how much it's going to impact the world, but you get the feedback, and they're so grateful for you coming and sharing.
Thank you.
Thank you very much. Hip, hip.
Do you know about the MHF program? Mental health facilitator?
Yes.
Yes, is that helping you?
Yes, that can help me.
In Malawi at the time, very few guidance teachers, what we would think of as guidance counselors or school counselors in the schools, had received specifically mental health training. They were very well trained as teachers, but were not given really any mental health or helping skills as part of their training. Kenneth Hamwaka, who's the current director, felt that the MHF program could fill that gap.
The Guidance and Counseling Center for Africa, based in Lilongwe, Malawi, is excited and really excited to see that the mental health facilitation program is going on very well.
Because there are so many teachers who have gone to train as counselors in that school, that's in Rongo, and I'm one of them. And here we have so many. We have, madam, can you stand up? We have that one. Where is the other one? Madam, where are you? Yeah.
And also it has helped a lot of students to have that effective communication among themselves as well as the teachers.
Komanso uphungu utafika vana va school amayi akahusisana ango kumbatira okha nayesetsa kupezana ndi mafumu kuti tithandizane kutani kupereka uphungu.
Of course, our very first training in Malawi was a training of trainers, where myself and Dr. Scott Hinkle traveled to Malawi and trained a group of teachers and staff with the Ministry of Education in the program, and also the training skills, as I mentioned. We were taken to a school where we saw that the student-teacher ratio was 120 students for every teacher. Not only did these teachers teach 100 to 120 students each, they also cooked a hot meal for them every day. Every one of the 2,200 students got a hot meal every day made from the hands of these teachers. And there were no separate cooks or no other help. And that really brought the impact home of what a program, we hope, like MHF, can do to at least offer some skills to teachers to help them deal with those kind of realities in their schools.
Now, when more teachers were trained on mental health and facilitation, there is tremendous change in behavior. Learners are happy and united. There is no fighting in the schools. Effective communication with the parents and the community as we teachers are working.
Depending on where you get the statistic, it's believed that there's a between 12 and 14% HIV infection rate in the country of Malawi. Because of that, there is a phenomenon within the schools where there are a number of fairly young children, under 15, who become heads of their own families. They are trying to support and raise their younger siblings as well as themselves, get them through school, provide for them, put food on the table, do all the things that adult parents would normally be doing for children.
My mom died when I was 5 years old. She followed my sister's death, and my father died when I was 5 years old. So
they lose girls that do get to go to school into the secondary level, then a number of them drop out when they become pregnant, that this is a common occurrence and difficulty there. And we visited another school in one of our more recent visits to Malawi, where the headmistress, when she welcomed us very formally in front of all of her students and staff, told us that since the MHF program was implemented in her school, they had not had one girl drop out due to pregnancy. And she believes that's the direct effect of the MHF program and the skills the teachers have learned and been able to pass on to the students through the MHF club.
We sampled some statistics from the government hospitals around Salima, and we heard at that time in 2011 that a lot of maternal cases were teenagers, and the statistics were 80% of women who were frequenting the maternity wing were below 18. 13, 14, 15. School-going children, that was an alarming figure. 80% was really alarming. It meant we are losing out on the women, we are losing out on the girls. So MHF was also partly addressing that. No wonder you heard the village head talking about teenage pregnancies, early pregnancy, and now the payer is saying that has been reduced. Thanks to MHF, because now girls and boys realize they have a potential in their life and they are looking forward to achieving their ambition.
But the solution is we have to be assertive, stay still in education, because nowadays everything is education. Do you have high self-esteem? Come and see the fruit of education. Thank you.
We have had several opportunities to go to Malawi since the program was implemented and really find out the effect of the program. One of the things that the center did that would have never occurred to the staff of NBCC International is to implement MHF clubs in the schools, like we would think in the United States of a glee club or a chess club or the beta club. And in those clubs, which are led by MHF trained teachers, guidance teachers, and teachers, they were teaching some of the basics, communication skills of the MHF program to the students, as well as giving them a place to meet, to talk through issues, common issues that they have, in a safe place with some people, adults guiding the group who've had some training in MHF skills so that they could cope with whatever comes up.
Learn how to take care of ourselves and challenges and emotional and physical challenges which girls and boys meet during adolescence stage.
Well, as I time back, I lost my grandpa and it was something that was confusing to my head, and even it affected my education. Now the teacher encouraged me to join this club so that I can be assisted. So she has some ideas there.
One of the fundamental truths in counseling, and I think in any kind of work like this, is that lots of times people think they're the only ones going through a particular issue. So it's given the children a place to talk about common issues, to find out that a lot of their peers are going through some of the same things, a place to get some relief and having a safe place to talk about those issues, and then also a place to get some intervention.
What are the effects of smoking and drinking beer on emotional wise? Lack of self-control, lack of knowledge, people lose balance. What are the effects on school? School dropout, unwanted pregnancy, low performance.
While we were visiting this elementary school, we first were treated to performances by the children that illustrated the skills that they were learning in their MHF clubs and the things that they're thinking of and the skills that they're utilizing in order to cope with things that are happening in their lives, both at home and at school.
In the clubs, school clubs, there are a number of activities that they do. They do dances, they do games.
And members of the village also came to see this performance and to be part of welcoming us while we were there in Malawi. And the head woman of the village stood up and, through a translator, shared with us that she thinks the MHF program has helped bring the community closer, because she believes that the teachers have really tried to share their skills and share their training with people in the community, and the community is feeling very heard, and that basically that this has helped bring the community closer, which was wonderful.
Komanso ife tinakhala anthu osangalala chifukwa chonena kuti mafumu amene azungulira munomo ndi maphunzitsi tinakhala ngati tinapanga chibale, ndiye chifukwa chake pologalamu itafika pano pa sukulu sinalemere kwambiri chifukwa chakuti maphunzitsi aja atayilandira pologalamu ija anayimwaza mwasangasanga, sanayifulatire iwowo kuti popeza izizi tazilandira ife tingopanga kuno fa uphungu wako zopereka kuno pamene kunyumba ife siunatifikire, ndiye kuti mwina amulangiza kuno mwana ukosanga kamuthe kumulangiza, ndiye tinanyadira kwambiri.
The unfolding of the Mental Health Facilitator program has proven more than just an idea. It's been more than a two-sided collaboration and more than a small piece of foreign aid. The unfolding of this program has revealed the power of the human spirit, the sharing of ideas, the impact of local, national, and international community outreach, the positive influence of effective communication, decreased school dropouts, and the connectedness of all humankind. Mental Health Facilitator is indeed on the move.
Kwambiri. Thank you.
Thank you.
Siku kwambiri.